allied health assistant is somebody that's went through a certificate 3 or 4, typically through TAFE, and they've worked with allied health professionals to learn a range of different skills and interventions that they can do. Typically, they're supporting people with therapy, so they're helping them improve their skills and capabilities in their everyday lives to meet their goals.
Allied health assistants are there to help us provide ongoing services to clients that have been assessed by our allied health clinicians. So they're there to actually provide the ongoing treatment programs for clients that have been deemed as being stable and requiring repeat practice of specific programs.
Being an allied health assistant is such a diverse role. No 2 days are the same, and it's a lot of fun. We are implementing all these therapy programs and across disciplines such as physio, exercise physiology, speech therapy, OT, dietetics, and mental health OT. So we're across so many disciplines and each day is different.
The good thing is, if you're working as an AHA, you're always going to have new sort of disciplines emerging, and you get the opportunity to learn from every single provider. And yeah, I find it really rewarding. You're never bored and you can never get too complacent. You never think you know everything. There's always still so much more to learn.
Having skills and knowledge across all disciplines, it allows me to view the client holistically.
There's a range of benefits of having allied health assistants as part of an organisation, but I guess for us at Community Therapy and every healthcare organisation, we're here to serve the community, and allied health assistants being part of a model of care let us do that even better. It allows us to see people in a more timely manner, allows us to see people more frequently. Sometimes a physiotherapist mightn't be able to see someone enough times a week or a month that maybe an allied health assistant can help us do. So in the end, an allied health assistant's able to help support the community more when that's part of a model of care.
The allied health assistant rate is a lower rate than the allied health professional rate when we're looking at things like NDIS clients. We can actually stretch that client's funding so much further by using the allied health assistant than what we can if we're using the allied health professional. If the allied health assistant can take care of those stable clients, it means that the allied health professional is then freed up to take on more clients that are needing that assessment, report, prescription, those things. So for us, it's a win-win-win. The client wins, the clinicians win, the business wins. I would definitely encourage other organisations to use allied health assistants. It's fantastic. It's made such a difference for what we can offer.
Having an allied health assistant has been a real blessing for Wayne and I, because sometimes you don't always get the funding that you need, and now it has doubled our hours, which has been terrific, and Wayne can have more therapy, which is helping in his recovery, which has been fantastic.
I really, really love when I get to have that breakthrough moment with a client who is a bit resistant to exercise, particularly for those who have things like dementia, and they have they're quite fearful of new things, or they can be quite socially isolated. And it's just so lovely taking them out for walks in the sun and just sitting down in the courtyard and just seeing them smile, like such a simple thing. Of course, I'm very interested in all of the physio components of it, but really that's what it all boils down to, those little moments.
I love this job because I just have an absolute passion for disability, and I love building these relationships with clients and seeing them reach their goals. To go into a client's house or into an aged care facility, or have them come here to the clinic to see me, to put a smile on their face and to get them excited about their therapy and just to make a difference in their lives, it means the world to me.